Hey, how's it going? It's Simple Lines Anatomy. We're going to be talking about the unseen or often not spoken about benefits of manual therapy. So, when we say manual therapy, this is kind of a general term for what you might call body work or hands on therapy, or even some of the physical therapies. And this can fall under the practice of physiotherapy, chiropractic, osteopathy, massage therapy, and then many others. They have benefits that are more obvious, the physical benefits of doing these things, but then they have benefits that over time have some big effects. That's what we want to talk about today. And so we're going to introduce these in our drawing here. Anyway, so it's commonly known that manual therapy has an effect on tight muscles, certainly, and joint movement. This is often why we see a practitioner of one of these things. We see them for specifically these, usually. And it does a good job at relieving those for sure. Without getting too complicated, because there are many details involved in all these things, but to get rid of a tight muscle, to improve the movement of a joint, we often do things like strain reduction, softening of rigid tissues that are not moving well, things that should move but don't, and then we make joint positions more optimal, where they should be. They have a preferred placement and we get them there. You can get a lot more complex with all this stuff, and usually this is all happening at the same time. It's all being done as one thing, but the reality is this is generally what happens when you're seeking out a manual therapist for treatment. So now, these things, if you can get rid of them, that's great. But these things do take a toll on the body if they're left for too long, if they're left to just be there and wreak havoc, if you will. And they'll all do two more or less simple things, one of which is waste energy. Energy is devoted to them that doesn't need to be. And another thing is something we call sympathetic activation. You may know this as the fight or flight system. It's a part of the body that reacts to stress and fears and things like that. And it's important that we deal with these things because the lasting effects of them impact us in a much bigger way than you might think. So, in this very simple picture here, we're going to say this is a body. So let me just get rid of a couple of layers here to make it real simple. So at the top, of course, we have a head, and then our shoulders and spine in blue, and then just a real simple line for the hips and legs. And you'll notice in this picture, we've drawn a spine with some big curvatures to it. This is pretty extreme, and it's a pretty extreme example. And it's just to demonstrate. You wouldn't always see things like this in the manual therapy world, but often enough you do. In any case, when we have the body changed in position like this, what we are lacking at this point is weight bearing on the proper surfaces. So if I add a little bit of weight and gravity, the pressure downward when you're sitting or standing, these things make a difference over time because the pressure should be in the center, should be right in the middle there, nicely placed. And what we have is some surfaces that it's not hitting on. And so the body likes to have these nice, even, balanced vertical lines, and we're very much lacking that at this point. So when that happens, what the body likes to do is actually add muscular contraction. So that's on this right side of the page here. It contracts in an attempt to keep you upright and straight. Otherwise, this kind of a bend would just make you topple over. You'd fall over quite likely because you'd be so unbalanced if it didn't pull you to the side. And now the contraction, unfortunately, is a big waste of energy. It's an expenditure you normally wouldn't have. What also tends to happen when you get these big curves and it's usually one side versus another, is that you get strain of the tissue, whether that's a muscle or a ligament or a tendon or what we may call in general a fascia. You get strain of that tissue and pain from it. And the effects of that are pretty big overall. It's not just a simple matter of pain, it's what happens as a result of the pain. In any case, this is actually happening all up and down the body. We've drawn it very simply here, but understand that it would be coming through the legs, the upper parts of the body, and it can go all the way up into the neck and head for sure, too. So, in any case, when we have this contraction side of things, so we have a contraction, very simple equation. Contractions require extra energy that we normally wouldn't be expending. So this seems like nothing. It's nothing to contract a muscle for a short period of time. You're used to it, you can do it. It's just like holding a position. But over a long enough period of time, with enough muscles involved, when the whole body starts to become involved in what we might call a compensation pattern, it's a lot of extra energy over the years and even decades. And so this means we actually don't have as much energy going to restoring the body. The body is unfortunately always breaking down. This is just a normal thing, and we don't really have any choice in that. The thing is, it's always being rebuilt too. And so if the body's always being rebuilt, that's okay that it's breaking down, because it should be compensated for. If you're building at the same speed that you're falling apart, you end up being pretty okay with it. It's when you stop building as fast as you're breaking down that you get into degeneration. So if you waste energy on muscular contractions that shouldn't be there, then you end up in an energy deficit, and you don't rebuild as fast, you don't heal as fast, and you don't recover as fast. So getting rid of some of those muscular contractions is a bigger deal than you would think it is. Now, on the strain and pain side, strain and pain create sympathetic activation. Again, that's like our fight or flight system. It tells us that something is dangerous, and we probably need to get away. That's how we're all kind of hardwired, and that's often what we do. There's certain social aspects of this that are very important, and that's a very different conversation. But physiologically, inside the body, we all kind of react the same way. We're all wired through our nervous system to do this. So when we get pain, or when we're stressed out in general, because many stresses will cause the same thing, but physical pain will also cause this, and it will be blood flow changes to the heart and lung, to the muscles, and to the lower centers of the brain. And with blood flow changes, you get a difference in the placement of nutrients. So those blood flow changes will make it so that there's more oxygen, let's say more glucose, more nutrients and proteins and fats, more really important vital upbuilding stuff go to heart and lungs, muscles, and lower brain centers, as opposed to other places. Other places, of course, still get blood, but this is really important. These things make you really good at running away from stuff and punching stuff, though I don't recommend it, but it makes you really good at running away from stuff. What it doesn't do, unfortunately, is make you really good at rest and recovery, which brings us to our next point. Where the blood should be going for optimal health is a very different area. You may call this the other side of the nervous system, what you call the parasympathetic nervous system. And that's a fine name for it, but it's where it's going to, or where it should be going to, is the important thing here. So when we're under stress, physical stress or otherwise, the blood tends to go away from the skin, the digestive system, and the higher centers of the brain. And we don't need to get too complex with this, but it's a very easy thing to understand. The skin, though we often associate it with appearance, and we should, because when skin has a good blood flow, it is very good in appearance. You look more vibrant, whereas when you have poor blood flow, when you're stressed out, you look a little more pale, maybe a bit gaunt, that kind of thing. But more important than that, much more important fact, is the skin is an important immune barrier. If we lack good skin integrity, it cuts and gets punctured easier, which means that bacteria and viruses can get into us much more easily. It also has really important secretions which help kill off and mediate those viruses and bacteria. So we want healthy skin if we want to be healthy in the long term and prevent sickness. The digestive system is another place where under a stress state, blood will be moved away from, so less nutrients go to it. And this is really important because the digestive system is actually what absorbs all those nutrients in the first place. So what you eat travels through this tube system and gets broken down and brought into the body. If there is a poor blood flow to the area, you won't be able to absorb as well or as much of those nutrients. And so in a very simple way, if you have poor digestive system blood flow and poor action, muscular action of those areas, which also require energy, it doesn't matter how good the food you eat is, because you can't get anything from it. And this is, of course, an extreme case. But the fact is, if your digestive system is, 1% less functional, that's 1% less nutrients you get from your food. So in the long term, this is really important. Short term, not a big deal. Stress, short term, no problem. But in the long term, you'll lose the ability to properly absorb nutrients into your body, and therefore those important upbuilding processes, the repair and recovery of the body, get slowed down. Now, the higher brain centers, this can be incredibly complex, but we're going to avoid that entirely. Just understand that the higher brain centers they're exactly what you think they are. They are for high-level complex reasoning. They're important for thinking processes and making sense out of things, really. It's quite simple. The lower brain centers, by comparison, which get much more blood flow when we're stressed, are good at running the organs and getting our heart rate up, controlling our lungs, that kind of thing. Again, good for running away. But our higher brain centers, they give us the ability to reason and think clearly. We've probably all been in some kind of a stress state where normally certain things would be easy decisions to make, but because of that stress, because of all the anxiety involved, somewhat simple things become very, very hard in that moment. And so this is one of those reasons. And, we've probably all experienced something at least similar to this in our life. In any case, this is why when we add manual therapy to your recovery from, say, a sports injury or to just a back injury, some very normal stuff, or even if we add it as a health maintenance program, adding manual therapy to your daily or monthly routine of fixing your body and helping your body progress and helping your health, it can affect many different aspects of life. Because you'll notice that when you start to free up energy that is wasted in the body, and when you take away these irritations of the sympathetic system, your whole body gets better, not just your physical body. And so this is why it can be important for a full person recovery to add that element of manual therapy or physical therapy to your health. Again, we are Simple Lines Anatomy. I hope that made sense, and thanks for watching.